Let's take a moment here and talk a little bit about your medical condition, nerve pain or neuropathy. For those persons who may not be intimately familiar with it, nerve pain can be caused by a variety of different conditions. Probably the ones most people may be familiar with is the nerve pain that might be attributed to diabetes, where you have diabetic neuropathy, which is usually a burning or tingling sensation, which normally is experienced in your extremities. Or it could be a particular condition that's caused because something is impinging on your nerve. In other words, you have something like, for instance, in your lower back. Let's say that you have a bulging disc and that disc is pressing up against a nerve that causes nerve problems. Nerve pain or neuropathy, whatever the case may be, is again, when persons are asking me about a particular medical condition that might cause them problems, one of the biggest things you see with people with neuropathy or nerve pain is pain. The key question is not that you have the condition itself. The key question is really, how much does that pain affect your ability to do things? And keep in mind, it's the wide range gambit. When I mean wide range gambit, I mean your ability to, trying to get the bearings right, it could be your ability to do normal day-to-day activity, pain, because let me stop for a second. Let me straighten my tie. Because whenever people come to me with problems with pain, I tell them there's a couple of things that you need to understand. Pain, in a lot of instances, there's a couple of things that they look at when Social Security is looking at how your condition affected by pain may impact your ability to work. First of all, they want to know, do you have anything that supports that you have a medical diagnosis basically, do you have objective medical evidence that supports your allegations of pain? If you're focused on nerve pain, a lot of times the biggest ones you're going to look at is an MRI, because let me just tell you where I run across pains a lot. Pain usually comes to me in one of three ways. And in terms of nerves, two ways. It's either something is pressing upon that nerve, which usually can be found in like an MRI, or you have some type of nerve condition, which is some type of neuropathy or retinopathy, or not even retinopathy, it's vision, sorry. Neuropathy, something of that measure, and that one is normally measured by a nerve conduction study. Okay, I believe it's EMG, nerve conduction study. I always forget the names, but basically, it's one that basically shows the existence of neuropathy. The first thing Social Security is going to want to know is, have you had any objective tests that shows that? A lot of times people say, oh, the doctor says I have nerve pain. Well, they've got to rely on something that points them to that. So you want to make sure that you have a copy of whatever evidence, whatever diagnostic testing you receive that shows that. That's the first thing. Then you got to ask yourself, is it reasonable for the type of condition you have to cause the level of pain you're alleging? People, when you're talking about pain, I've talked about this in other videos as well. You got to think about the gambit. What medications are you taking? What type of treatment are you receiving? When was the last time you had any testing regarding it? Pay attention to how pain affects you in a day-to-day life. Think about it. When you're in pain, you're not focusing on what's going on. It's hard to stay on track with what you're doing because a lot of times when you have a sharp pain, it distracts you. Think about when you wake up in the morning and you're in pain getting up out of the bed. You don't jump out of the bed like you used to. I ain't a lot. In my younger days, I used to joke that literally, some of my friends said it was nuts. I could get up running. I literally could get up out of bed, grab my books, and take off and be lucid when I'm rolling. Now I'm at that point where, look here, I need a minute or two to catch myself. But the reality is this. When you're measuring pain, you got to ask yourself a few questions. First, what is your pain level threshold? Meaning, on a scale of 0 being no pain and 10 being pain so excruciating you can't function, where are you at? Now, this is one of the things that I sometimes tell people. I want you to be realistic about your pain. A lot of times people aren't realistic when it comes to pain, even nerve pain or neuropathy, because everybody thinks by saying 10. Hear me when I'm saying this. If you can consciously say you're at a 10, that's saying that your pain level is so high you cannot even function. I hate when people say, oh, it's 11. If you're 11, you wouldn't be here because you wouldn't even be able to function. So be realistic when you sit down and you say what your pain level is, okay? Think about it. And sometimes there are people like, well, there's no checkoff box. You know your pain threshold. If I'm telling you that Do you have zero pain? Well, no, I'm in pain. So we know it's not zero. Can you function? Well, yeah, I can function. Okay, so that means it's not exactly a 10. It's somewhere in that range. Be realistic about it. That's the first thing. Second thing, be realistic about where your pain level is when you're on your medication. And think about it. Think about it like this. For instance, if you have medication that you're taking once a day, it's not as needed, but once a day for your pain. Ask yourself this question. Let's say you're supposed to take your pain medication every morning when you start your day. Great. So you start your day, get up in the morning at 8 o'clock. How do you feel before you take your medication? Oh, I'm about a 6 to 7. It's off the chain. Oh my gosh. When you take the medication, let me straight from this for a second. When you first get up in the morning, are you able to function? No, because my pain is really off the chain. I need to take my medication. How long does it take for that medication to kick in? Okay. Then you ask yourself, when the medication is at its optimal performance, meaning it's kicking in, does it lower the pain threshold? Yes or no? If it's yes, to what? And then when it lowers that, is that the lowest it goes? Yeah. Or no. Does it go lower? Well, yeah or no. Whatever your answer may be. How long will it stay at that level before the pain goes back up? If the pain continues to go up, so I'll have people who will tell me my pain level will go up to about this level. Okay? Usually by the end of the day, 4 or 5 o'clock, it's back. I start at 7, take the meds, I drop down to like a 3 or 4, and then right around 2 o'clock or so, I start creeping back up to about 5 or 6, and then by the time I go to bed at night, I'm about a 7 again, and I'm like in a lot of pain. Do you take anything for breakthrough pain? What is breakthrough pain? That means that it doesn't matter what you're taking, you need a little extra because it's not helping. Do you take any extra medication as needed to help you sleep through the night? Here's the biggest question that I'm going to ask, because we've already started about this. We got pain threshold before you take meds, pain threshold after you take medication. Have you told the doctors that the medication is not working? What are they telling you to do in the event that it's not working? What are they giving you for suggestions? And this is the one thing that catches people all the time. They don't think about it like that. You want to be able to paint a good and accurate picture of your pain. And more importantly, you don't want to just be throwing it out the backside of your hip. You want you want your doctor to be aware of where you are in your pain threshold so they can document it so Social Security can have something to properly refer to. Anytime you're dealing with pain, it doesn't matter if it's normal pains like back pains, aching, or something like that, fibromyalgia, types of muscle pain, or nerve pain. Anytime you're alleging pain, you have probably an extra not duty. It becomes a little bit more tricky, but the reality is that you've got to be able to paint a good pain picture. Because just saying I'm in a lot of pain doesn't tell Social Security anything. You've got to be able to paint a picture so that they can determine how that picture would be able to apply to you being able to work. And more importantly, that's a picture you need to be painting for your doctor so that they can adjust it accordingly, so that if by some odd reason that picture doesn't change regardless of what they do, at least you have documentation that you've made every effort to try to address it.